Good morning. You're listening to Dental MD on KKNW. That's 1150kknw.com for my archives. And the Dental MD radio show is all about natural, holistic dentistry. My name is Dr. Jessica Saepoff, and I've been a practicing dentist for 30 years, and about 25 of those years has been holistic. And I have a practice here in Western Washington, in the Seattle area. And actually, I want to make an announcement because we have officially moved the practice. It is no longer in Issaquah. We are now located on Mercer Island, and I've been developing that location, and we have finally made the move. So let me just, for the record here, I'll give you the address. The phone numbers and website and email, that's all the same, and I'll tell you what all of that is as well. So we are now located at 7513 Southeast 27th Street on Mercer Island, and that's Suite B, which is the office in the middle. There are three offices there on that level. Anyway, we're right above Mercy Vet and O Chocolate, if you've ever seen that little building on Mercer Island. We're on the second floor, so you drive up 27th and turn left into the parking lot, and we're right there. All right, so the phone number for the office is 425-427-8899, and that is our regular old number, and it's getting forwarded to the new office. And the website is still naturaldentist.com, and the email continues as appointments@naturaldentist.com. So if you want to come and see me and have an appointment and have an exam and a cleaning, I mean, it's a regular, we are a natural holistic dental office, and I am a general dentist, but I'm trained in a lot of specialty areas. The only two things that I don't do at that office are root canals and extractions. I don't do any surgery, and I don't do any root canals. If you want a root canal for a tooth, I will give you a referral to somebody who does them all day. I think it's a great idea to go, if you do want one, that you go to a specialist that doesn't do anything except root canals, because there's a very high standard of doing them properly, doing them well, even though I'm not a big fan of root canals, especially sometimes I think they're done unnecessarily or prematurely, and there are a lot of people who actually prefer to just remove the teeth if the pulp inside the tooth, the nerve tissue, has become necrotic or is on its way to becoming necrotic, that they would just remove that tooth, and then there are a lot of options for replacements. And so one of my tasks when I do an exam or I am evaluating a problem tooth is to give you all of your options. So I will give referrals for extractions as well if you decide you don't want a tooth, or if a tooth is really, condemned and can't be restored for whatever reason. But the areas that I have specialty training in, and I'm not a specialist, but I have extra training in some specialty areas, and the main one is orthodontics. I have several years of additional training in orthodontics and orthopedics. Now, TMJ therapy is not a specialty. You might know of a dentist or have heard of dentists that claim to be specialists for TMJ, but there is no such thing. Any dentist can, it's not a recognized specialty, I'll say that. But there are some dentists that are maybe oral medicine specialists who treat TMJ, and so then they say, I'm a specialist, I treat TMJ, but there's no actual TMJ specialty. That's temporomandibular joint, in case you didn't know. It's your jaw joint when you open and close your mouth, your jaw joint, which is right in front of your ears, jaw joints in front of your ears. That's what moves. It's a synovial joint. There's a disc and a synovial membrane The only other joint in your body with a synovial membrane is your knee, and it's really unlike, it's a ball and socket joint, kind of like a hip also. There's no other joint in your body that's like it. And it's, if anything goes wrong with your jaw joint, it's one of those areas where it's very hard to limp. You can't really limp. You have to talk and eat and swallow and breathe, and you have to be able to move your jaw to do all of those things. Or at least it's more comfortable to be able to move your jaw to do all of those things. So it is a very important joint, and there's quite a bit of ignorance about it, even among dentists, because it's not really covered to any great degree in most dental schools. How to evaluate it and how to treat it is not well covered. So I thought that was an area that, one of my things that I do is I look to see what services are hard to find, that there's underserved population. There are people out there suffering and struggling and unable to find care. Then I look to see what that care would be and what's needed for me to get up to speed and become proficient and beyond proficient in caring for people with that problem. And TMJ problems fell right into that category. So I went ahead and got, probably, a cumulative maybe 5 years of continuing education credit on TMJ, orthopedics, and orthodontics. And the two are separate because one is dealing with the jaw joint and the other is moving the teeth. But obviously, your bite is directly related to how your jaw functions, and how your jaw is feeling or doing affects how you move your jaw, which affects how your teeth meet. And the two are very connected. It's kind of ineffective to treat the jaw joint and not address the bite, and it's ineffective to change the bite and not look at how that is affecting the jaw joints, especially if those jaw joints are already having reduced mobility, clicking, popping, and or pain. And so I decided that I would look at that whole system as a unit. So I got a lot of extra training in those two areas, and I treat patients for both preventing TMJ problems and solving TMJ problems. Once I got to a certain point with that training and experience, it became really clear that the other area that's directly affected by your jaw posture and tongue posture is your airway. And not the airway just like nasal and sinus, but behind that, where in children adenoids tend to overgrow, right behind the maxilla in the upper nasal airway. And then the next area down is the pharynx, which is the area that your tongue, if allowed to drop back, can block it. If the pharynx itself does not have the proper innervation, it can become more collapsible than it should be. I mean, you can actually be asleep and have that normal sleep paralysis for the rest of your body, but your pharynx, your airway, is not supposed to go into paralysis. That's supposed to be governed by another nerve system that keeps it going, like your heart and your breathing, your diaphragm. These are things that are not supposed to quit working while you're in dream sleep, REM sleep. So there's something amiss when the airway shuts down, and there are a lot of different reasons why it does, but the area I work in, the jaw joints and the bite and the tongue space, the whole like oral cavity space where your tongue is supposed to be, if that is constricted, if things are too narrow, if your bite is too deep, then the vertical airspace and lateral airspace, horizontal airspace in your mouth may not be enough room for the size tongue you have, the size tongue you have, and if your past includes having extractions and retraction orthodontics, where they took out bicuspids and then brought everything else in to close those spaces. Now the specialists are saying that making your dental arches smaller can't affect your tongue space or your tongue function, but there's a whole group of people that feel that if you make the mouth smaller, then it's possible that the tongue may feel like there isn't quite enough room, and it may end up back further than it should be. There are a lot of people that agree that tongue position and the space of your oral cavity affect how your tongue sits or doesn't sit in and blocking your airway, especially at night when you're asleep. So it turned out that understanding airway and sleep medicine also became important in what I was doing with TMJ and orthodontics. So those are the kind of specialty areas. There's no actual recognized specialty in dental sleep medicine, it's called. Dental sleep medicine. Sometimes people think that has to do with sedation and sleeping through your dental visit so that you wake up when it's over and, you've taken some sedation drugs so that you don't remember any of the, difficulties of having all this dental work done or the pain or whatever. But no, that is not what dental sleep medicine is. That's sedation dentistry. Dental sleep medicine is sleep apnea, snoring, airway issues that can be solved or modified, improved by jaw posture, tongue posture, just mechanical and other ways to manage airway while you're asleep, sometimes in combination with CPAPs, which you would see a physician for, and you would see a physician for being tested in the first place before any dentist can actually make you any kind of fancy night guard type appliance for airway support. So those are the specialty areas, but dental sleep medicine is also not a recognized specialty. Any general dentist who is trained in that area can treat patients for these ailments. So that's everything that I do according to the principles of natural medicine, which means the least invasive and least toxic possible way to accomplish the treatment and solve the problem. All right, we are coming up on a break. I will talk more about these issues when I return after this break. You're listening to Dental MD. I'm Dr. Jessica Saepoff. Be right back.
People say it's hopeless. Money rules the world. It rules with an iron.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
It's pouring rain. It's real dark outside. Your heart starts beating really, really fast. You've never done anything so hard in your life. This is boot camp. This is the real thing now. It's such extreme pain, you don't understand how you can finish. I began to feel that there was no way I was ever going to have my title, U.S. Marine. It takes special inner strength, courage, and desire to do this. I was just thinking, I'm so close. I'm so close. And when I finished, I was like, I'm done. I did it. The moment I will never forget is when this drill instructor that I admire so much comes up to me straight in front of me, put her arm on my shoulder and said, "Good morning, Marine."
PFC Summer Volkman became a Marine. Can you? Visit Marines.com or call 1-800-MARINES. The few, the proud, the Marines.
Find our app in the Apple App Store or Google Play Store and take us with you wherever you go. Alternative Talk AM 1150.
You're crazy. You can't break that wall. It's too old, too big, too strong. Never gonna fall.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Saepoff, and today I'm talking about general topics in natural dentistry. And the word natural, it has no legal definition from what I understand, so it can really be put anywhere. It is now, however, anything related to natural medical or dental is actively, I believe, I think the algorithms are now finding that word and redirecting people who are doing searches online to approved sites where the information is more mainstream. So if you're not getting what you are looking for when you're doing searches, try some different kinds of search terms, such as biological. I don't know whether the algorithms have caught up with all the different terms that apply to alternatives in medicine and dentistry, but integrative, biological, complementary, these are all alternative search terms that you might use when you're looking for alternatives in medicine and dentistry. Now, our website name, naturaldentist.com, I don't know how the algorithms are dealing with that particular search term, so any feedback on that would be appreciated. But because all of my computers go right to it because they've learned that I go look at that site and make modifications. So it's very difficult for me to do a search unless and get organic results unless I use somebody else's computer. So anyway, hopefully people won't have trouble finding us. And as I was saying in the first segment, I am a general dentist, but I have a lot of extra training in orthopedics, orthodontics, temporomandibular joint dysfunction, or TMJD, which is what that is. But usually people just refer to it as TMJ or TMJ syndrome or TMJ problems, TMJ therapy. You could look up that way. And also airway, sleep apnea treatments and airway. And as a general dentist, I also do restorative dentistry, and I do checkups and cleanings and all the usual regular garden variety stuff that you would have services at any general dental office. Now, according to the principles of natural medicine, all of those areas of dentistry, operative dentistry or restorative, and hygiene, the hygiene department, which in my office is me because I really like gums, so I don't have a hygienist. I do all of the cleanings myself. I have an assistant that does the polishing and other, some of the x-rays and that kind of thing for me, according to my orders. But everything is done according to the principles of natural medicine, including those standard, regular, run-of-the-mill, routine treatment areas. And the way that gets handled in a holistic office might vary from one office to another, but at my office, when I do restorative work, if there is any old metal still in your teeth, any kind of metal, because even the fillings or onlays or crowns or whatever they are that are already in and on your teeth, even if it says gold or looks like gold, it has other metals mixed in. It's an alloy and there are other metals, and in any event, even if it was pure gold, you still don't want to be breathing in any dust and debris from the removal of any materials that are currently in your teeth. So anytime there is any kind of metal that we're removing, not just the mercury fillings, but any kind of metal, we use a variety of safety equipment and safety protocols to make sure you don't breathe or swallow any of the dust and debris or vapor, because in the case of mercury fillings, there's not just dust and debris, but there is vapor coming right off, especially if the burr is generating heat, which is why we use water on the burr as we're removing the old stuff, because that keeps it cooler and also keeps the dust more under control so it doesn't get out into the air. If too much water is used, then there's splatter, and that splatters it up into the air. So there's a nice sort of happy medium amount of water that keeps everything cool but doesn't cause splatter. I'm a low splatter dentist. So I don't want that stuff splattering out and evaporating and leaving mercury vapor and garbage floating around in the air in the office, because we don't want to walk around and breathe that stuff all day either. You don't want to breathe and swallow it, and we don't want to breathe it. So I use a variety of protocols. There are some protocols that have been publicized online by some of the holistic organizations. Their protocols are not based on enough research. It's based on research done by leaders in those organizations who are trying to make a name for themselves. And those protocols are good, except that there are some aspects that are excessive and maybe even designed to trigger alarm in you, the patient, because when somebody comes at you in a head-to-toe hazmat suit with a gas mask on, that can be a little alarming, a little scary. And I think that the research does not prove that that kind of getup is actually preventing exposure for anybody. So, because I have looked at the research that is supposedly supporting those protocols, but I use a number of well-known safety protocols, and I have had tests done that support the way that we are doing it at my office. And so if you have old metal, even if you don't necessarily want it all replaced right now, if you have a tooth that needs a new restoration and there is any metal of any kind still in your tooth that we would have to remove in the process of restoring your tooth because of decay or breakage or whatever was going on there, we will be using all of our safety protocols to make sure you don't breathe or swallow any of that dust or vapor, and that it doesn't get into our air, because we don't want to walk around and breathe it all day either. So if you have a need for restorations, obviously, you can probably tell from what I've said already, we do not place any mercury amalgam. I haven't used that stuff in more than 25 years. There's no reason to use that anymore. There probably was never a reason to use it. But anyway, the mercury filling material is ridiculous, and it's been obsolete practically from the time it was created and brought here and popularized. So other metals that you might find in your mouth, though, may not have mercury and don't have mercury. Unless it's a mercury filling, there's no mercury. But what there is nickel and beryllium and other crappy allergenic and toxic metals that have been blended with other metals, including gold, and sometimes it'll look gold, but it's got so much other stuff mixed in that we just automatically use our safety protocols anytime we're removing anything that's got metal. And so that's my philosophy on metals and restorations. But the other part of the philosophy, that's the toxicity part, Also, you can be tested for biocompatibility, because the new filling material or ceramic or resin that's going to be put in your tooth, you're going to be living with that for a while, and you want to make sure that that's as high quality as possible. And so the only materials I use as replacement materials and restorative materials have been tested by numerous canaries, I call them, the highly sensitive people who get tested. And so the only materials I carry are the ones that most of the canaries have been okay with. But if you're a canary, you may want to get tested to see whether the materials I have are going to work for you, or whether there's some other material that I would need to order, restorative material, just for you, so that what we're putting in your teeth is as biocompatible for your chemistry as possible. All right, we're coming up on a break. And when I get back from this break, I'm going to talk about the dental hygiene department and how we have transformed that to be aligned with the principles of natural medicine. All right, you're listening to Dental MD. I'm Dr. Jessica Saepoff. If you have questions, you can reach us by email, appointments@naturaldentist.com, or give us a call, 425-427-8899, and I'll be right back after this break.
'Cause there's no wall too tall, no wall too tall to fall, no wall too tall.
I'm Dr. Anthony Lazarus, and this is Climate Connections. On 10 acres near Washington, D.C., Lincoln Smith grows food, but he does not plant in large tilled fields or tidy garden rows. He farms in the forest.
There is plenty of nutrition that can be derived from a more diverse forest-based agricultural system.
In his forest garden, Smith grows trees that produce edible nuts and fruits, such as persimmons, mulberries, and pawpaws. The trees grow alongside mushrooms, greens, and perennial berries.
Black raspberries, blueberries, currants, you name it.
Smith also designs forest gardens for others, even in urban and suburban areas. He says planting small forest gardens not only provides more locally grown food, it increases the tree canopy.
So we're providing better wildlife habitat. We're, of course, sequestering carbon in the trees themselves and in the soil organic matter that is accumulating year over year as you grow the forest. And then with the healthy soil comes clean water, because the water that falls on that site is going to filter through that soil before it goes into the stream, in stark contrast to, of course, a parking lot or a tilled field.
So with forest gardens, people can grow food and help protect the climate, all on the same patch of land. Climate Connections is produced by the Yale Center for Environmental Communication. Learn more at yaleclimateconnections.org.
Time is funny. Sometimes it seems fast, and other times slow. When it comes to time slots remaining on Alternative Talk 1150, time is running out. In fact, there are just a few primetime slots available. So if you want to host your own radio program, the time to call 425-653-1150 is right now. Nope, no time for excuses. Dial 425-653-1150 to find out how affordable it can be to host a radio show. Alternative Talk, we have an opportunity waiting just for you.
Wondering what's on next on Alternative Talk 1150? Check out 1150kknw.com.
Money vendors crowd the temple, survival crowds the heart.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Saepoff, and I'm talking about basically general topics today on how natural dentistry, some of the ways that ordinary dentistry can be done, provided from a point of view of the principles of natural medicine. And so, one of the things that is very important to me for you as a patient is to drill as little as possible, less drilling. So anytime I can solve a problem with less drilling and less plastic, that is the way that I do it. So even if I'm just doing a little sealant on somebody's little tooth, I am not letting that material pool up in the grooves so that it's like a big area of sealant, because that's, surface area matters. So I put the material just in the deepest part of the groove, and I move it around with an instrument that just brings it into the grooves and spreads it around just in the deepest part of the grooves. And I don't use any materials that have fluoride added. The materials I use are biocompatible, known biocompatible products. So I use a material that is the same consistency as what is sold as sealant material. It's kind of a little bit more runny, like almost like a honey consistency. And it's called a flowable product, flowable resin. And sealant materials are flowable resins, except that they are not intended for long term. They're really just intended to get those kids through the cavity prone years, so they say. And so they frequently fail after, 2 to 5 years. But it's also hard to find sealant material, like stuff sold as sealant, that doesn't have added fluoride in it, because the belief system is that the more fluoride you put in, on, near, and around the teeth and in the person with the teeth, the less decay they'll have. And, fluoride there are a lot of other ways to prevent decay that are a lot less toxic. So that's, according to the principles of natural medicine, you would, if you want to prevent decay, you would look at all of the different possible ways to inhibit, prevent decay, and remineralize early lesions, decay lesions. You would look at all of the ways, and then you would select the ones that are the least toxic and the least invasive and the most biologically compatible for that individual with their individual chemistry, biochemistry, and genetics. And that's the material you use. That's the service you provide, the procedure you do. Whatever it is, it has to align with those principles. So the way that I do just a sealant on a child or anybody's tooth, that I don't think, okay, insurance will pay for sealants like up to age 14 or 16 or whatever it is. But every so often there will be an adult that has become more cavity prone for whatever reason. There are lots of possible reasons for that. And so if it's appropriate to seal a groove that's precarious, not quite a cavity yet, but looks like it's degrading, and other efforts to remineralize it aren't effective enough, and you want to really stop that process and you want to do a sealant, I really don't care whether the insurance is going to cover that for you or not. I'd still rather do a sealant than a filling, because there is less drilling involved, maybe even no drilling, maybe a tiny bit to clean the groove, and then the sealant is placed. So when I place a sealant, it's only going to be on any tooth that I think fits that description of appropriateness for a sealant. I don't care how old the person is or young. And I will seal teeth only if they fit the description of being vulnerable and where remineralizing is either not working or not feasible, and more protection is needed and it isn't a cavity yet. That is the description that, for me, justifies placing a sealant. Because after all, they are plastic, so you don't just want to have sealants put on every single tooth just because the insurance will cover it. Oh, they reached a certain age and the teeth are in. The insurance will cover sealants on all these teeth. We better seal them. No, I'm going to actually look at the teeth and decide, based on my clinical experience, whether those grooves are vulnerable. Do they look vulnerable? Are they deep? Are they shallow? Are they stained? Are they, of the 4 teeth, 1 has a cavity and the other 3 have stains in the grooves. Those other 3 teeth are kind of vulnerable. They came in at the same time. One of the 4, brand new molars that just came in already has a little cavity starting in a groove. The other grooves are getting stained and look vulnerable. Yes. it is appropriate to seal the other 3 that came in at the same time and do a filling on the one that has an actual sticky hole starting in the groove. So those are the conditions that I will place a sealant, and it's a sealant if there isn't decay. It's not about what the material is. It's about whether you are bonding some bondable dental resin of some sort into a groove. You etch and use bonding liquid and put the resin, flowable resin, in that groove and cure it with a curing light, and then it is a sealant. It doesn't matter what whether the material itself was sold as sealant material or not. A bondable, flowable resin is what is required to seal grooves. So those are some of the ways that I apply the principles of natural medicine to something very simple like that. And a lot of times, because insurance covers sealants for kids, it's in the category of pediatric dentistry or dentistry for children. And I know it's very hard to find holistic dental care for children, because there just don't really seem to be a lot of specialists that want to focus their practice on the principles of natural medicine. Most of them don't believe in that. They may give it lip service. They may say, oh yeah, try some xylitol, but here's some fluoride too, that kind of thing, because we know fluoride works, but it actually doesn't work the way they think it does. If you look at all the research instead of just the research that the mainstream puts out for dentists and the public. And pediatric dentistry, there are a lot of ways to approach children from a natural medicine standpoint. One of the things that is really important to me in my practice is I don't want any child to feel traumatized. And we're not just dealing with the teeth. We are dealing with a human being that has will and has a right to participate and cooperate. Sometimes if you force treatment on a child, of course, if you do that, you have to either drug them or hold them down. And those experiences result in a type of post-traumatic stress, which later we call that dental phobia or dental fear. And now that's big business. That is big business, sedating adult patients who break into a sweat at the idea of making a dental appointment. And it's in a lot of those cases, it probably was preventable simply by working with a child. When that person was a child, if somebody had been patient with them and worked with them to gain their cooperation and done things in a less aggressive way, it is possible to do things virtually painlessly. Sometimes things are uncomfortable. For a child, having a cotton roll in their mouth can be a big discomfort. Their view of everything is very different from ours. And also their teeth, the primary teeth, are a little bit different in terms of what they feel. They can feel pain, but it's a little different what the stimulus is that can cause that pain. It's different for primary teeth than it is for adult teeth. So what would cause pain in an adult tooth may not feel like pain in a pediatric molar or a primary molar. The nerves are different. They're just different. So, I will give that child an opportunity to allow, vibrations and cold and things like that, and help them distinguish whether what they're feeling, if it's painful, then we always anesthetize. And if it's just vibrating and kind of tickly, and I can get the tooth cleaned out, the cavity cleaned out, and it only feels kind of tickly and wet and cold, but not actual pain, and the child is not tense and they're still smiling and laughing and opening and letting me go in there with my instruments to clean the cavity, then I know I'm not traumatizing them. They're talking to me. They're happy. They're cooperative. I just continue with that mode of, having that child continue to cooperate with me and continue to consent to what I'm doing. I make sure that no matter how old the person is that's in my chair, that throughout their appointment, that they are continually at choice, continually giving their consent and reaffirming, yes, go ahead and do the next step. I'm ready. And that, I think, helps to unravel post-traumatic stress from previous visits, and it also prevents new trauma and new stress that could make the idea of having another dental visit in the future be uncomfortable or anxiety provoking. So these ways of relating to my patients, it's very important to me, and actually these methods take longer. They take longer. It means more conversations with the patient. It means more working with them, doing things in different ways sometimes that is more comfortable for them. That takes longer. Sometimes it takes more than one visit to do something that in a standard dental office where they're holding somebody down or drugging them, they can get stuff done in one visit. So for most dental offices, efficiency and how long it takes to do things is extremely important for their, bottom line and production for the month and all that kind of thing. I don't care about that stuff. I care about I care about not creating any kind of trauma of any sort to the physical structures in the mouth or to the person and their emotional state. All of that is important to me. All right, coming up on a break, you're listening to Dental MD, and I'm Dr. Jessica Saepoff. If you have questions or you'd like to make an appointment to come and see me for any reason, to have teeth checked or fixed or whatever it is that you need, you can give us a call, 427-8899, and you can reach us by email, appointments@naturaldentist.com. All right, I'll be right back after this break.
But we know a greater power in the hearts of the young and the old. Love for all the children. The compassion.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
The Alzheimer's Association and the Ad Council present the story of Tom and Levi.
Tom is the smartest man I know. He's been a professor at 2 major universities, been a teacher for over 40 years. One day, he told me that he was having problems in his classes. I think one of the students had asked the question and he didn't remember the answer. And I also noticed that he was letting his class out earlier than they were supposed to let out. And he was telling them that he was doing it as a favor to them, but I think in reality, he just wanted to get out of there. I was really starting to worry because I saw something was wrong.
Levi and I talked about how it would change our lives, but he was there beside me, and my love for him was just immense.
When something feels different, it could be Alzheimer's. Now is the time to talk. Visit alz.org/ourstories to learn more. A message from the Alzheimer's Association and the Ad Council.
Get inspired every hour right here on Alternative Talk 1150.
I say no wall too tall, no wall too tall to fall.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Saepoff, and I'm talking about how general dentistry can be provided according to the principles of natural medicine, which is what I do. Everywhere I look, I look to see whether there's some way that I can take an ordinary dental procedure and use the principles of natural medicine to transform it so that I am still providing that service, but I'm doing it in a way that is the least toxic and least invasive way to do that procedure for you possible. And so I go to a lot of continuing education. I take a lot of courses. I'm educated in a lot of natural medicine modalities and energy medicine and psychology of your experience in the dental chair. I want to make sure that that is, as I spoke in the last segment, I want to make sure that when you're finished with your procedure, you feel peaceful and at peace with what has been done for you. I'm not doing something to you. Your experience should not be that I did something to you. It should be that together we got something accomplished, that I was doing something with you and for you, with your continual, ongoing, reaffirmed consent throughout your entire visit. And that's when your entire nervous system and physical structure and energy component and psychology are all aligned with, feeling good about having gotten something accomplished for your health. I know that was a long-winded way to say that, but so now I want to talk about how I apply these principles in the hygiene department, the dental hygiene department. A lot of people have a fear of getting their teeth cleaned. Why is that? Why would a dental cleaning elicit anxiety and fear and phobia and make you want to just put it off and not get that done? There are actually people who like getting their teeth cleaned. They like the feeling of the scaler and they like the sound of it. And I know if you're one of the people that hates those things, it's hard to believe that there are people that like that, but there actually are. They feel like their teeth are really clean when they leave, even though these might be people whose teeth are not as sensitive as yours. Maybe you have very sensitive teeth, and when somebody picks up one of those instruments and touches the root, it's uncomfortable for you. And when you tell a dentist or a hygienist that a particular tooth or area is sensitive when you touch it with the brush or your fingernail or anything, toothpick, and they immediately pick up an instrument to check and see whether, how sensitive it is. Oh, let's see how sensitive that is. They just want to diagnose it. They want to know how sensitive it is so they can figure out what's wrong, so they can fix something. And when you tell someone that your tooth is sensitive when you touch it like this, and the first thing they do is pick up an instrument and try to make contact with your tooth, I mean, of course, that's not very respectful. So we can start with that, just being a little more kind and gentle. So when I want to test a tooth, I will start with teeth that aren't sensitive so that you can get a feel for what the instrument feels like on the tooth, on a tooth that isn't sensitive, so you know what's normal. And then when I get to the tooth in question, I start out really, really gentle, and I start out in a spot on that tooth away from where you pointed to, so that we can see whether it's the whole tooth or really just that one spot. And I just sort of zero in on it kind of gradually. And then when I do get to that spot, I start so light and just on the edge, just to see whether, it's responding. Maybe today is a day when that tooth isn't even bothering you. But my point is I'm really respectful of, if you tell me a tooth hurts, I am not going to just jump in there. I'm going to work my way over to it and just kind of help you get used to the sensations of the instruments before I check that area. And I also check the other side, same tooth, other side, and see whether it's something symmetrical, because that can make a difference in terms of my understanding of what the problem is or what's causing it. Okay, so in the hygiene department, in the dental hygiene department, that is usually where the dental exams take place as well, unless it's an emergency exam or a specific exam, which we call a spec exam, where you're coming in and you're not having a cleaning or anything else done. You just have an issue and you want somebody to check it and see what it's going to need, if anything. But in the hygiene department, that's where routine exams usually take place, new patient exams and recall exams. And the dentist is the one that does the official exam. The hygienist will do parts of the exam that relate to specifically your gums and some measuring that they do, where they check for pockets and check recession and that kind of thing. And they will notice, they're trained to notice things that are not normal, like holes in the teeth or things that are broken. And they're not really permitted by their licensure to diagnose what those things are, but they know when something is not looking normal, and they will write all those things down so that when the dentist comes in, the dentist will look at everything and then focus on, things they found and things that the hygienist found as well. So the exam and a cleaning will take place usually with the hygienist kind of organizing your appointment. So at my office, I don't actually have any hired dental hygienists. I like gums and I like to do the cleanings, and I like periodontics, which is the treatment of gums and gum disease. So I apply the principles of natural medicine in my hygiene department by opting for, well, let's say there are different ways to clean the teeth, and there are different ways to measure around your gums. Now, the standard way to measure around the gums is to take the little instrument that has the little markings on it for how many millimeters of depth. We're checking to see whether bacteria have invaded around the gum line, collar of the gum around the tooth, and whether they've invaded and they've gone down and they're living on the roots underneath that gum tissue, and how far down the root they've gone. So when we measure, the instrument gets dropped down in there gently, and when I meet a little bit of resistance, that means there are some fibers there. Sometimes it'll feel like some actual calculus stuck to the root. That feels different. But when I get down to resistance that's a little bit soft, but definitely resists the instrument a little bit, then I take my measurement there. A lot of times, people who are doing these measuring, they do it quickly and they use a fair amount of force, and so they don't really notice that first bit of resistance. So they're putting a little more pressure on it, and when they get down to like real, more solid resistance of tissue down there, that's when they take their reading. And in my opinion, it's possible that they're kind of pushing through a little bit of the, and this may be why it's uncomfortable, why it feels pokey and pinchy when they're doing they may be using a little more pressure than I do when I do my measuring. So I do the probings that way, the measuring of around the gums. And then for the cleaning, I don't like to use the metal scalers. I prefer to use an ultrasonic instrument. And this is more and more popular, but you may never have had that done. There's an ultrasonic instrument that is used. There's vibrations, sound vibrations put in the water, and then this little tip that has no blade on it and no point on it. It's just a little slender, blunt tip, and that is used to guide this vibrating water around, under the gums a little and between the teeth. And, you can really get all the way down to the bottom of the pockets with this thing and clean the roots really well, and there's no scratching and scraping. And if the water is warm, then the teeth aren't sensitive to cold when you're doing it. And I just think this is a more gentle way. It does remove everything from the root and from the tooth. And I think, I get people that come in that have never had their teeth cleaned with one of these, but I've been using it for 30 years. So I know that most dental offices have one. I'm not sure why they aren't using it, and they're just using the scratchy scrapey. But anyway, that's the one of the ways that I'm more gentle. We also use polishing paste that has no added fluoride, coloring, or flavoring for the polishing. So, all right. So I've covered hygiene. I've been talking about the principles of natural medicine applied in dentistry. If you want to get an appointment, give us a call, 425-427-8899. And we are in our Mercer Island office. You can go to the website naturaldentist.com to get a map and the address. So we will see you there. You've been listening to Dental MD. I'm Dr. Jessica Saepoff, and I'll be back next week.
Once in a lullaby.
The views expressed on this program are those of the host, guest, and callers, and not necessarily those of KKNW, its management, or other advertisers. Contests are the responsibility of the host of this program and not KKNW. This is Alternative Talk 1150 AM, KKNW Seattle.